Welcome. Today we'll be talking about handling morning reports. Handling morning reports. The definition of a morning report is debatable as its purpose, setting, structure, and components vary. In the past, the emphasis has been on the daily monitoring of clinical activities and patient care rather than education training of professionals. Nowadays, morning reports is the most visible education feature for our students. Morning reports traditionally describes a case-based conference where learners and teachers interact, discuss patient care, allowing learners to develop their professional competences. So these meetings primarily focus on sharing updates, setting daily objectives, addressing immediate concerns. It is effective in improving patient care, which might be lacking. It has evolved into a system for a case-based learning that facilitates education of trainees. Morning meetings are useful for discussing patient management issues, teaching, learning clinical methods, which include diagnostic tests, therapeutic procedures, and developing presentation skills. Effective communication and efficient transfer of patient care information between teams has become essential to ensure continuity of care. So this in case, let's say a clinician was a night duty in the morning when we are doing morning handover, it helped to transfer patient care so that the other clinician can take it from where the other clinician has stopped based on uh, time frame that different clinician would be placed on in a clinic. So there are various purposes for morning reports. Purpose number one is to strengthen preceptor-student connection. So during morning report, that's where preceptor can interact with the students to gain how much are they learning, where are they lacking, how best you can push for improvement. It's also a good way to take note of students' professional behavior instances, punctuality, neatness, and improve school culture. Morning meetings also provide several benefits. They encourage a team cohesion, boost morale, and enhance productivity. Morning reports is one of the practical and valuable methods in clinical training, and it also improves problem solving ability. And the other purpose is to improve presentation skills and conveying optometric or medical knowledge to learners. Morning meeting can facilitate a scheduled face-to-face handoff procedure that has been shown to have fewest protocol deviation compared to a written and electronic sign-in protocols. So when clinicians meet and do a morning report, the handover is better than doing it over a phone or maybe just writing notes and pressing it in a file. So, structures of effective morning report. Let's look at the structures for effective morning report. So, a structure of a morning report will involve case presentation. Under this, there will be you introduce the patient chief complaint, past ocular stroke medical history, current medication, if you did refraction, fundoscopy, lab tests, other findings, and diagnosis. So those are some of the things that will be in a case presentation. Then there will be a discussion. So team members will look into what has been presented and will look at the management, final conclusion, and documentation. Then there will be a follow-up plan to determine the cases that have been discussed and how the patient have been managed, the prognosis of the case. So basically, that's how the patient care structure should look like. So what are some of the laws of a preceptor? So if you're a preceptor, number one, you're supposed to be a role model to your students. Be a role model to your students in terms of punctuality, in terms of your dressing, your behavior. Be a role model to your students. Number two, you have to facilitate the discussion. If they come to your office with a case, facilitate the discussion, and also ensure educational value is observed and maintain the standards operating procedures. As a preceptor, maintain standard operating procedure, maintain focus on patient care. So whatever you're doing with your students, focus on patient care, guide and integration of clinical learning objective into the report. So there should always be a learning process in the process. Assessing learning needs and setting goals. So if you see that your student has needs in a certain area, you can give them assignment. You can try to bring something along so that the learner at the end should get knowledge in that area. Develop and implement learning plans. Let there be learning plans. Ask them, what are your objectives? What areas are you failing to make it so that you can improve their skills in those areas. The other thing is teach time management and prioritize in patient care. So prioritization in patient care is very important, that they shouldn't just waste time doing things that are not necessary. Evaluating clinical competence and documenting learning and clinical processes. Teaching and promoting clinical listening. That's very important. So as a preceptor, you have to promote clinical listening, critical thinking, and problem solving. So as a clinician, as someone is a trainee, make sure that you are promoting at all costs clinical listening, critical thinking, problem solving, because that is what they're going to be doing on their daily basis. Providing constructive feedback and coaching. So as a preceptor, you are there as a coach. You are coaching them for today, that tomorrow they should be better practitioners. Applying effective communication, interpersonal, and conflict management skills to foster collaboration and patient satisfaction. So always they should aim at the best. The other thing as a preceptor is supposed to do is facilitating social interaction, acclimatization to the organization's unit and culture. Let them learn the culture of the organization. Let them be part of whatever is happening so that they don't feel left out. Drug reaction reporting. Teach them that if they see any reaction of a particular drug, let them report. Promote decision-making skill, patient management, and self-directed learning and ethical issues. Let all these be part of their agenda. So involving students in morning reports is very important. So we can involve students through asking them questions. For instance, if there is a CBT, you can involve them by asking them questions. Ask them questions, give them assignment, routine case assignments, give them group assignments to prepare and present. Involve them in demonstrations. Involve them in demonstrations. And the other part is doing evaluation and feedback. So feedback can be given right away. Sometimes constructive feedback need to be given on one-to-one basis to provide a good environment for expression and asking questions. There are certain feedback you can give whilst others are there, but sometimes certain kind of feedback, whether negative or positive, we can always provide another platform to provide such feedback so that the information can be beneficial to the recipient. Provide feedback at all times. So this helps to have an honest conversation. When you provide feedback, you tell them maybe the way how you did that particular test, next time do it this way. Provide feedback that will be constructive. Make sure you do proper, in the sense that students will soon be out of the teaching space. they'll also be independent somewhere. So it's always good to give them feedback. Yes, you did well on this one. Yes, you did well on this one. Because tomorrow they'll be somewhere else. They'll do the job on their own. So they need to know what exactly they should do. In conclusion, morning reports are essential part of optometric stroke medical education because they emphasize the need for clarity, brevity, and relevance in presentation. Overall, morning report provide an excellent opportunity for trainees to exercise, improve their knowledge, leadership, presentation, and problem solving skills. If you have questions, if you have anything, put it in the comment section. I'll be able to answer your question. Remember to subscribe to this channel for more tips and clues